Hello and welcome back to my channel. If you're a dental student, a postgraduate, or a clinician diving into research, you're in the right place. Today, we're tackling one of the biggest challenges in research: how to find a meaningful research gap in prosthodontics. By the end of this video, you'll know exactly what a research gap is, the 6 types you need to look for, and how to find one authentically even with the help of AI tools. Let's get started. You've read 50 papers. You know the textbook answers. But when you sit down to write your thesis proposal or plan your first research project, there's that one question: what should I actually study? The answer is always the same: find the gap. But what does a research gap actually look like? And how do you find one specifically in prosthodontics? In this video, I'll walk you through the 6 types of research gaps, with real prosthodontic examples for each. And then I'll show you a practical step-by-step strategy to find your own gap. Let's get started. A research gap is simply a question that has not been adequately answered by existing literature. It's not just, nobody has studied this, it's more nuanced than that. A genuine gap exists when existing studies have contradictory findings, a population or condition has been overlooked, the methods used are outdated or insufficient, there's a disconnect between theory and clinical practice. Let's look at each type. Type 1. Evidence gap. This is when studies on the same question produce conflicting results. Take immediate loading of implants in the mandible. Some studies report 95% survival rates. Others report higher failure rates in specific populations, say, patients with bruxism or poor bone quality. Why does the gap exist? Different sample sizes, different follow-up periods, different inclusion criteria. Prosthodontic question you could ask: in patients with moderate to severe bruxism, does immediate loading of mandibular overdentures on 2 implants show comparable survival to conventional loading at 5 years? Notice that I'm not asking a generic question. I'm narrowing it to a specific population where the evidence is truly contradictory. Type 2. Knowledge gap. This is the classic: nobody has studied this yet, but it must be meaningful, not trivial. Prosthodontic example: we know a lot about how systemic diseases like diabetes affect implant outcomes. We know a lot about how TMD affects jaw function and pain. But what about the intersection? Genuine knowledge gap. How does the presence of temporomandibular disorders influence implant treatment outcomes in patients with rheumatoid arthritis? This gap exists because the 2 conditions, TMD and rheumatoid arthritis, are often studied in isolation. Let me give you a pro tip: knowledge gaps often sit at the boundaries between 2 fields that rarely talk to each other. Type 3. Practical knowledge gap. This is the gap between what research says and what clinicians actually do. Prosthodontic example: the literature clearly recommends regular recall and maintenance visits for implant-supported prostheses. Yet surveys show that a significant percentage of clinicians don't schedule structured recall and patients don't return. Prosthodontic research question: what are the barriers to implant maintenance recall adherence among edentulous patients with implant overdentures, and does non-adherence correlate with increased biological complications? This type of gap is gold for survey-based or mixed methods research. Type 4. Methodological gap. This happens when existing studies used limited or outdated methods and newer, more rigorous approaches could give better answers. Prosthodontic example: many studies on residual ridge resorption have used simple linear measurements on panoramic radiographs. But newer methods like CBCT volumetric analysis or even AI-driven segmentation could provide far more accurate data. Research question: using CBCT volumetric analysis, what is the true rate of 3-dimensional resorption in the anterior maxilla during the first 6 months post-extraction? You're not asking a new question, you're asking an old question with better tools. Type 5. Population gap. Most prosthodontic research comes from a narrow demographic, often Western, urban, with good access to care. We know very little about how treatments perform in different populations. Prosthodontic example: implant survival data for patients in rural or low-resource settings, or for specific ethnic groups with different bone metabolism profiles. Research question: are implant survival rates in patients with type 2 diabetes comparable between urban tertiary care centers and rural district hospitals in India? Population gaps are especially powerful if you have access to a unique clinical dataset that others don't. Type 6. Theoretical gap. The existing theories or models may be incomplete or insufficient to explain what we observe clinically. Prosthodontic example: we have models explaining TMD pain, biopsychosocial model, and models explaining residual ridge resorption, metabolic, biomechanical model. But there's no unified model that explains how chronic pain, systemic inflammation, and bone resorption interact in the TMD patient. Potential research question. Can a unified biopsychosocial inflammatory model predict residual ridge resorption rates better than the existing biomechanical model alone? This is PhD level work developing or testing a theoretical framework. Here's a practical 5-step strategy to find your gap. 1. Start broad in your area. 2. Read 2 to 3 recent systematic reviews and note their limitations and future directions. 3. Use the PICOS framework and cross-check with AI tools for rapid synthesis. 4. Check the future directions section of every paper. 5. Ask, so what? The gap must be clinically meaningful. Now let's talk about reliable AI tools that can help you find gaps authentically, meaning they accelerate discovery but never replace critical reading. Recommended tools are Elicit.org, wherein you can upload or search papers. It extracts methods, findings, and limitations across dozens of studies. Great for spotting contradictions quickly. ResearchRabbit and LitMaps for visual literature mapping. They show citation networks and reveal isolated clusters or undercited areas. Scite.ai for shows whether papers support, contradict, or mention each other. Excellent for identifying evidence gaps. Consensus.app and Semantic Scholar quick evidence synthesis with AI summaries and citation context. Prosthodontic example. Search, implant over dentures in diabetes. Elicit and Scite will show you within minutes that most studies are short-term and exclude patients with poor glycemic control, revealing both a population gap and an evidence gap. Important rule. Always verify AI outputs against the original papers. Use these tools for speed and pattern recognition, never as the final authority. So to recap, there are the 6 types of research gaps in prosthodontics, namely evidence gap indicating contradictory findings, knowledge gap indicates untouched territory, practical versus knowledge gap reflects what we do versus what we know, methodological gap shows old tools, new questions, population gap tells us who's been left out, and theoretical gap indicates models that don't fit. Reliable AI tools like Elicit, ResearchRabbit, LitMaps, and Scite can help you map the literature faster, but the final gap must be validated by you. If this helped, subscribe and comment. What gap are you currently exploring? See you in the next video.